This is Newmarket Equine Hospital, one of the largest centres for treating horses in Europe. We see over 3,000 cases a year from the UK and overseas. NEH is full of state-of-the-art diagnostic equipment you'd expect in any human hospital. We have over 40 vets with a team of specialists taking care of our patients on site. I'm Matt Smith, a consultant at NEH. This is a 2-year-old thoroughbred filly in training, and she presented lame with swelling in a fetlock joint caused by chip fractures. This injury is quite common in racehorses, and although it causes relatively mild lameness, if left untreated, it may well recur and develop into arthritis. One of the main benefits of this keyhole approach to surgery is that it's much less invasive than conventional surgery and requires much shorter recovery periods.
So it's been clipped, it's had its shoes removed, and the aim of that is to make it quick and efficient once the horse arrives in theatre.
The procedure should be relatively quick today, about 20 minutes of surgery time. The horse is all prepped ready for me now, so I will drape out the surgical site before starting with surgery. First thing we're going to do is to inflate the joint with some fluids to create some space to put the arthroscope into it. So I'll place a needle in the joint and then use some sterile fluids to inflate it, so we can see the joint distending. But that's all gone well, and having done that, the joint surfaces actually look pretty good, and we'll get some repair tissue form where we've removed that fragmentation. And my expectations for this horse are good. So at surgery, that all went very well. I removed the fragmentation, the loose cartilage flaps. At the edges here, the cartilage is all still well attached and healthy. Taken away the damaged bone, so we've got a nice normal bed underneath it, and that will allow it to heal. We've learned an awful lot more by doing the surgery, and the prognosis for this horse I can now say with reasonable confidence is good for returning back to race training. In the olden days, to treat this we'd have had to open the joint right up, and to do that the injuries would have healed much quicker than the actual surgical approach to the joint which we made. So you'd have taken many more months to get the horse back into training. Whereas with this, we'll be waiting somewhere around about 6 weeks for a reasonable repair tissue to form, and at that point we're getting the horse fit again and getting it back into training. By doing this arthroscopically, it's revolutionised the prognosis for these horses. Today, Fran James, one of our specialists, is investigating a very typical case of unexplained lameness. X-rays have proved inconclusive in this case, so Fran is going to be performing an MRI scan.
So this is an interesting case. It's a horse that's had the acute severe lameness. Lameness has been localised to the region of the foot, but unfortunately on X-ray there's nothing to explain the degree of lameness that this horse is showing. And so we've chosen to take an MRI of this horse's foot to get more information about the reason why this horse is lame and to try and adjust its treatment accordingly. The MRI gives us a lot more detail about the bone and the soft tissue contours that we can get on X-ray. MRI is able to tell us about the fluid dynamics in the bone and about subtle changes to the bone injury. So for MRI, any amount of motion is a problem and will disrupt the quality of the image. So unlike human patients, we can't ask our patients to sit very still, so we give them a small amount of sedation. Too much sedation obviously causes motion, but we do start with a small amount of ACP, which I'll just give now, to calm the horse before it goes in, and we can then additionally top it up as we go. Cool. So it's just an intravenous injection. I'm just checking to confirm that it's in the vein, and then that will take a few minutes to take effect. Good chat. So for this type of injury, typically this is a lesion that would be treated with oral aspirin treatment. Somewhere in the region of 3 months would be a typical rehabilitation process of controlled exercise to manage the damage to the bone in that area and allow a period of healing.